When parents get a diagnosis that their child has autism, it can be beyond overwhelming. I am going to share today some tools and strategies and an autism diagnosis checklist. This is really great information because when you get that diagnosis, maybe it's something that you knew your child had autism deep down inside, or maybe it's something that's a surprise. It can be hard to know how to navigate all the different services and all the different things that you may need to do for your child to make sure that they're getting the help that they need. We're going to talk about that here today. If you're new, my name is Rose Griffin. I'm a speech language pathologist and a board certified behavior analyst. I am the founder of abaspeech.org, where our passion is to help every single child with autism and individual with autism find their voice, increase their communication skills, and become independent communicators. Make sure that you subscribe to my channel as I'm adding videos weekly. So today I want to talk about an autism diagnosis checklist. What do you do when your child is diagnosed with autism? The resource that I'm sharing with you today, and you can see it down below and click the link, is from an organization called Milestones, which is an organization here in Ohio I really, really love. It was started by two autism moms who I believe met in the waiting room of a therapy provider, and they came together and they created an amazing organization called Milestones. They offer a lot of different resources, and they also have an amazing conference that's a 2-day conference now every June. So make sure to check that out. I usually present there too. So one of the first things that you need to do when your child is diagnosed with autism is learn about the different evidence-based therapies. I am a board certified behavior analyst and a speech therapist. So I would urge you to look up and really research applied behavior analysis that can really help your child in a very systematic way, not only with communication, but if your child is exhibiting problem behavior, if your child is having trouble with activities of daily living, like potty training and sleeping, all those different things, that can be a really amazing and powerful science to use in intervention for students with autism. That is something that's going to be really important, to do a lot of that different type of research, which can be overwhelming because there's a lot of information out there. Contact an early intervention agency in your area if your child is under 3. If your child is under 3, an early intervention agency will come to your home. That's typically how it's done, and they will do an evaluation, and they will determine what different services will be appropriate for your child. Reach out to your school district's special education director. So when your child is nearing the age of 3, it's important to contact your school district. Your school district then will do a full evaluation. And this should include things like an evaluation from a speech therapist, an evaluation from a teacher, potentially an evaluation from an occupational therapist, and potentially a physical therapist. This can be really overwhelming as a parent. I know that I had worked one year where I just worked in preschool, so we were working with parents who were potentially getting these diagnoses for the first time. But it's a lot of information to take in, but we really are all here at the table to help your child, to determine what intervention is going to help your child learn and grow. Initiate that request. If your child is older and you maybe got a diagnosis at an older age, make sure that you contact your school district as well to get that evaluation to see what supports your child may need in that school setting as well. Research opportunities for funding. There are different funding sources that you may have access to, as it can be very costly when you have a child with autism for all these different therapies and all the different things that your child may need to grow and develop. Educate yourself about IEPs, individualized education plans. That's typically when a child is in a school, the team does an assessment. We come together as a team, parents included in that team. You're a super important part of that team. And we look at that assessment results, and then we determine an intervention plan for your child. That could be an IEP where we're working on goals and helping the child throughout their school day and determining what supports, potentially accommodation, related services, which would be speech therapy, occupational therapy, maybe physical therapy. Potentially your school district may have a BCBA, a board certified behavior analyst that's helping out with some things that are going on as well. Or maybe you have an outside consultant that is coming in. Everybody is going to have a different makeup of their team. So you want to make sure that you understand that process. Your child may be on a 504 as well. And what does that mean? Maybe your child just needs a little bit of help with some things here and there. So making sure that we do research to understand those different terms and what those mean. Make sure that you find a speech language pathologist in your area, preferably one that is well-versed in working with students with autism. Because when you have a child with autism, there are certain things that we should work on to help the child increase their communication skills, and make sure that you have that ongoing dialogue between yourself and the speech language pathologist so that you can generalize things to the home environment as well. If you need to, find a board certified behavior analyst. This is somebody who can help you with those activities of daily living, that can help you if your child is exhibiting problem behavior. And you should be able to go to bacb.com and find a provider in your area as well. These are just some tips and strategies that are going to help you when you find out that your child has autism. As always, make sure that you click the link below. You can print this PDF out, put it on your fridge, and kind of help you navigate this time. Make sure that you subscribe to our videos because I'm going to be adding them weekly, and see you soon.